Hello, everyone. I'm Helene Bader, Vice President of Education for Healthy Women, and today we're here to discuss how women can select an affordable and effective health insurance plan. It is vital that women are equipped with timely tools to successfully navigate the different insurance plans and options so they can select coverage that adequately addresses their unique health needs and conditions. So, here to help us learn more about this topic are our expert guests today, Deb Gordon and Sarah Michaelchuk. Hi, ladies.
Hello.
So, quick introduction. Deb is the author of the Healthcare Consumers Manifesto, How to Get the Most for Your Money. She is also co-director of the Alliance of Professional Health Advocates and co-founder of Consumer Health Advocacy, Inc. Previously, Deb served as a chief marketing officer for a Massachusetts health plan, and she is an Aspen Institute Health Innovators Fellow and an Eisenhower Fellow, and also is a frequent contributor to Healthy Women. So welcome, Deb.
Thanks for having me.
Absolutely. And Sarah is the founder and CEO of Predictable.com, a health insurance transparency tool that educates consumers about their best options, no matter where or whether they work. Previously, Sarah spent 8 years as an investment banker into the insurance industry, and she is here with us to share her expertise. So thank you so much for joining us, Sarah.
Yeah, thank you for having me.
I'm thrilled to have you guys. Well, let's dive right in with our first question. So we know health insurance often seems really confusing and overwhelming to so many of us. So Deb, I'm going to start with you. If you can just break it down for us, why it is so important for women, especially, to have health insurance.
Sure. And, I've spent a lot of years working in health insurance. One of the first projects I ever did in health insurance, someone told me that I was doing market research, and a woman told me that receiving mail from her health insurance company back in the day when we got mail was like receiving an audit notice from the IRS. So I really understand that health insurance is almost nobody's favorite topic. And it's got its own language, it's confusing, it's expensive, it's like you just don't want to think about it. So I completely understand that. At the same time, it is so important to have health insurance coverage. In this country, there's so many we could have a whole other conversation about what's wrong with healthcare in this country, but probably top of the list is it's very expensive, especially if you don't have health insurance. It can be expensive with health insurance, but without it, it can be disastrous. So the first and foremost, most important reason all women need health insurance is that you need to protect yourself financially from catastrophic healthcare expenses. That's what health insurance does. That's its primary purpose. Second is that as women, there are all kinds of things that can happen to us that we might need, good and bad. We might want to have children. We might have, a health condition that is hard to diagnose. And they're just, as we go through our lives, our health needs change. And we need healthcare services at different points in our lives. It's really important that we take care of ourselves. I think there's a lot of discussion. We all know as women, we often put others first and we often neglect our own health. And if you have health insurance, it means you have access to healthcare, and that is so important for all women.
Would you like to add something, Sarah?
Yeah, I wanted to just jump in because one of the top questions we get is, do you guys ever recommend that someone not get health insurance? And so what I can tell you truthfully is the only people who could afford to not have health insurance are people like Elon Musk or billionaires, where, yeah, you know what? If you get into a car accident or you get cancer, you can negotiate $1 million bill with your hospital. So I just want to kind of put that out there as like the extreme. Yeah, it's possible for someone to not have health insurance, but that's what we're talking about when Deb mentions catastrophic events.
That makes sense. So I completely agree with everything you said. And I know from my own personal experience, looking through insurance plans and getting the bills in the mail and all of that, it is overwhelming. And it's really difficult to figure out how much everything actually is going to cost. It's really hard to find the bottom line number because you constantly are getting different numbers thrown at you. So how can you really tell what it's going to cost you to get health insurance all in? Sarah, do you want to take that?
Sure. So, of course, first of all, there's the distinction. Are you getting health insurance through your employer or are you getting it through some other means? And since we're still in open enrollment, we're at the tail end of it, just kind of briefly can address the marketplace, where you kind of run the gamut, where on the low end for a household, maybe you can get health insurance for $10,000 a year. On the high end, it can be up to $30,000 a year if you're looking at a platinum plan. And, those are the premiums. So if it's, the $30,000 platinum plan, that's probably going to be the majority of what you're paying. You might have no deductible, et cetera. The further you go down to that 10,000 end, you are going to be looking at, hey, if I go to the doctor, I'm going to be paying the whole thing through my deductible. So
Okay,
it's really.
Sarah, let me just quickly stop you. So you use two vocabulary words. I just want to
Yeah.
make sure we define them: premium and deductible. So what would that
Yeah.
mean?
So premium is what you pay every month. You might think of it as being comparable to your auto insurance or a different insurance that you understand better. And if you are in an employer, that's going to be in the form of a premium contribution. So it's going to come out of your paycheck as a paycheck deduction, will look a lot smaller, but that's a premium.
Okay.
And then, a lot of people understand deductible because they know that's what they have to hit. That's the part where you're paying 100% of it until you hit it. And then your, insurance starts to kick in and start paying things.
Perfect. Thank you.
Mhm.
Well, that's great. And since it does feel unaffordable if you don't have benefits from an employer, are there low cost options that are good? Because I know, we don't necessarily always get benefits from an employer.
Yeah. So, Biden has extended some things during COVID. So, one of the best things that's available are the subsidies on the marketplace, where, I was mentioning the $10,000 to $30,000 costs. But if you're a household that makes $100,000, with a couple, maybe, you can get reducing that by $5,000 to $10,000 a year. If you lose your job, if you've been impacted by the recent layoffs, you can go in and say, hey, my go forward income is zero, and perhaps automatically qualify for Medicaid, where everything is free. So you really, there is that safety net with the government. So if you're in, one of those buckets where your income is impacted, there should be an option for you. It gets a little bit trickier when you are an extremely successful freelancer and you're making $200,000 a year. Then you really have to pay the full freight.
Okay, that makes sense. Deb, would you like to add anything to that?
Yeah, I would just, I spent many years in Massachusetts working for a health insurance company that offered these plans. Medicaid is often administered through private companies, and the marketplace insurance plans, we were the first state to have a marketplace, and then the ACA sort of modeled on what we had done here. And so I think sometimes there's a little bit of concern or hesitation to accept a subsidy or think you're going to get good quality coverage if the coverage is free or very low cost. And I would just say that although there can be some limitations in the provider network, so which doctors and hospitals you can go see on some of these plans, they are highly regulated with a lot of consumer protections, which means that they must be high quality plans. And so if you find yourself eligible for a subsidy in the state where you live or on the federal, on the marketplace, on the health insurance marketplace, I would say take advantage of those savings because you could probably use that money for something else in your life. Or it could make the difference between having coverage and not having coverage. And you heard me say before, and I think Sarah agreed, unless you're a billionaire, it's really important to have health insurance. So I would, not worry about I wouldn't take any stigma or any hesitation about accepting a subsidized plan. I would say get the best coverage you can afford. And if that's a free plan on a state Medicaid program, get that coverage. Doesn't mean you'll be on it forever. Doesn't mean you won't be able to get the care you need. And there are a lot of protections if you run into any trouble.
And Deb, I might also just add kind of a warning. Be careful when you see those plans that are like the cost sharing groups, and read the fine print, because a lot of times they specifically exclude that catastrophic coverage we're talking about. Or guess what? If you want to have a baby, you can't on that plan.
Sarah, say more though about what those plans are. What, like, they're skinny plans? They're
They're cropping up. Sometimes they're sort of a short-term stopgap, and that can be fine. Actually, we'll get to a question of, is it too late to sign up? If you are too late, you can get one of these short-term plans and just kind of cross your fingers, nothing happens until next year at open enrollment. And so there's those, and those are legal and sort of okay, not great. But then there's these other plans where it might be some kind of affiliate group. Maybe it's through a church and they have good intentions and they're saying, we can cover this little piece. But you don't realize that, you're paying in, it feels a little bit like a union or something. You don't realize that it's not really there when you need it for something big. So that's why it's important to actually stick with the plans that are regulated by the government, regulated by the insurance industry.
And just to be clear, you won't find those plans on the health insurance marketplace. So if you go to healthcare.gov or your state's equivalent, you won't find an association plan or a skinny plan.
Yeah.
You might be offered catastrophic coverage. Sarah could speak to that more in more detail than I. That's only for certain populations, and it's not necessarily better than a silver plan with subsidies. Now we're getting into the
now we're down the rabbit hole.
Yeah, so now you're really talking health insurance speak here. So just to
we
clarify,
let two health insurance people talk to each other. Who knows what can happen.
No, it's amazing. It's really interesting. So I just want to clarify for our audience to make sure I understand this. So if there's like association or skinny plans, as you were calling them, how would you know that they weren't regulated? Is there a way, or is it just the fact that you're not doing it through the federal government's website? Like, what would they need to look for to say this really isn't what I should be going for? Is there ever a time when those plans are actually valid and good and are going to cover what you need?
I mean, you should ask what the underwriting insurance company is, and they might reveal that there isn't one. But the safest thing to do is to always start at healthcare.gov.
Okay.
I think that's kind of the point that Deb was making, because they might lie to you is the challenge, because they want to get you to enroll. They probably will check, hey, do you already have a cancer diagnosis? Like, they're going to ask you questions about your health when you're signing up, because they don't want you in there if you're not healthy. So if someone's starting to ask you questions about, do you have any pre-existing conditions? That's a bad sign.
Okay, good to know. And then I also want to touch on something you brought up quickly about the amount of money in terms of like what you're making and what qualifies you. Is it different from federal to certain states? Is there a certain amount like that you're like a certain number that we should know that we should start looking at federal plans, or what does that look like?
I mean, in general, I would say it used to be a lower threshold where if you make this much money, you don't get anything. And then in COVID, that was bumped up a little bit, so more people got benefits. So I'd say if you make under $150,000 a year in your household, check it out. It's going to be lower if you are, the only person with income in your household, or if you're single. But it's very easy to look. So there's no reason you shouldn't look.
Yeah, that's great. So, here at Healthy Women, we often talk to women who are living with various health conditions. So one area I thought we could discuss is uterine health. For women with uterine health conditions like fibroids or endometriosis, what are some key things they want to look out for when evaluating health insurance plans? Deb, do you want to answer this?
Sure. And I'm not a clinical expert. I'm not a doctor or nurse. So I come from the insurance side, but so nothing I am saying is clinical guidance. But what I understand about these conditions is that, first of all, they can be, torture. I've interviewed women with endometriosis who describe really what sounds like torture. And so if you can get relief from that pain, you really do not want to then bump into a health insurance, a financial barrier. So I think it is really important to evaluate health insurance plans based on not only the treatment and providers that you need and use today, but what you might need in the future. So what I understand is that many healthcare providers will move you from sort of basic, pain management, over-the-counter painkillers, and when that doesn't work, they'll try the next thing and the next thing and the next thing. And so for endo, that might be hormone treatment, or hormonal birth control, might mean a hormonal IUD, might mean surgery of different sorts. And similarly, Fibroids, again, I'm not a doctor or nurse, but I understand there can be relief from hormonal IUD. You might need surgery to remove fibroids, but I think the sort of terrible thing about these conditions is we don't have all the answers yet. We don't have, just if this doesn't work, then this will definitely work. There's still a lot of sort of insufficient treatment, I guess I would say, and also a lot in development and a lot of trial and error. So first you have to try something and fail, and then you can usually get the next thing. Hopefully there's a next thing. So what that means for your health insurance selection is you want to look at the kinds of treatments you might need. So that might be medications, typically medications and surgery. And not that there might not be other kinds of treatments, but those would be the big sort of buckets that you want to look at. How are those things covered? You may not find in your in the statement of benefits, or the explanation of how the plan works. You might not find endometriosis or fibroids specifically. So you want to think about the category of treatment that you need. And it can be really difficult, especially with medications, because health insurance companies can change the rules on that. They have to notify you, but they can change the preferred drug list. They can change the cost associated with each very specific kind of drug throughout the year. Like I said, they have to give you notice, but that doesn't mean that what you read on day one is going to be true on day 364. So I think the important things are to first locate any current treatments you have. If you're on a medication today, is it covered, and at what cost? Does it require prior authorization? That means that you have to get permission from the plan. Your doctor, your prescriber will usually help with that process, but you, the member, you, the patient, are responsible for making sure that the health plan approves of that drug. And even if it's something you've been on, let's say if you're in this moment looking at health insurance options, maybe you have a plan that is ending because you're leaving a job, or maybe you don't have a plan, but if you have coverage today and your drug is covered on your current plan, that does not guarantee it will be covered on a new plan. If you see prior authorization, you may have already gotten prior authorization on your current plan. You could have to go through that process again on the new plan, and there's really no guarantee that they'll approve it. There is a whole process and procedure. You want to understand what that is on the plan you're looking at, and you can get a feel for how easy or hard is it to get the care you need by looking at the NCQA as the national accrediting body that evaluates health plans. Not all health plans are accredited through NCQA, but those that are, many are, and NCQA does surveys of health plan members. And one of the domains in that survey is how easy is it to get the care you need. So you can look at those surveys as sort of a clue. If the plan scores highly on those measures, it doesn't mean your case is going to sail through with no problem, but it does mean that in general, people are pretty satisfied with those processes. And if that score plans badly on, how easy is it to access needed care, beware, because that probably means you're going to bump into administrative hassles and hurdles. So kind of understand, look at your current treatments and understand where they fit. Try to get a feel for, and you can ask, but they may not be able to tell you exactly, but a lot of things are in development. These are conditions that manufacturers and companies are looking to improve treatments for, which is great news for women. What it means for insurance coverage, though, is a bit of an unknown. When a new drug comes to the market, when a new treatment or surgical procedure is developed, will you be able to get it? I think that's a really hard thing to get at, but that's the kind of question you want to try to ask of the plan and look for clues about, such as through those surveys.
That's really
I,
helpful. I see, Sarah, you wanted to jump in.
I wanted to jump in just to add on, first of all, if you do look at your existing treatments, if you ever have the ability to move to a generic version of whatever you're doing, that's going to give you the most power shopping for insurance. Now, we've worked with tons of people with chronic conditions, and it's often the case nothing else works except for this. So obviously don't sacrifice your health, but do know that if you can go on a generic version of whatever you're on, then you can basically be on any plan. And then the other thing you can do for those experimental treatments, like Deb was mentioning, or the new things in development, is go appeal to the pharmaceutical company. And a lot of them have rebate programs. So you might be on a high deductible plan, but if you sign up through them, they might have some coupon program where you only have to pay $5 or something, and they'll let you hit your deductible. So there's a couple of other things you can do. But Deb is completely right that it is really scary if you are reliant on one of these drugs, because you might need to say, hey, I need to get that corporate job where I can bother HR and make sure this stays on the formulary.
So what about the healthcare providers themselves in terms of making sure that you have access to who you need? Because I know, for certain things, there doctors, like if you have a doctor you love, you don't want to change that doctor. Is there a way to make sure that they are part of that health insurance and that they'll be covered?
Yeah, that's such a really important question, Helene, and it's often the first question. I mean, I'm not an insurance agent either, so I'm not really advising people on how to pick and which insurance to buy, but just conceptually, when you're thinking about health insurance, I often say, if you're attached to a doctor or a clinic or another healthcare provider, first look and see if they participate in the network. This is where health insurance lingo and jargon come into play. In-network providers contract with the health plan, agree to see the members of that health plan at the health insurance company's negotiated rate, and you should have access to them. You still may pay a copayment or co-insurance or what have you to see them, but you'll be allowed to see them. If you're on a plan, if your provider is not in the network, then you have to look really carefully at the out-of-network coverage. Some plans have no out-of-network coverage. And what that means is if the provider is not in the network, you will get no help paying if you see them. That means you'll pay 100% of the bill. You can see whoever you want, but you won't get any help from health insurance to pay for it. If you have, again, if you're a billionaire, no problem. But if budget is of any concern or the services are, anything but the simplest, lower cost office visits, those costs could mean the difference between being able to see your preferred provider and not being able to. Now, there's something in the middle between in and out, which is some plans will have partial coverage for out-of-network providers. Usually, often what that means is you can see the provider, excuse me, you may have to pay out of pocket and submit that bill for reimbursement. And when you get reimbursement, you're going to get X percent, not 100, 60%, or Sarah might know the more, common reimbursement rates for out-of-network coverage, but it will be short of 100%. That may be worth it. If you can save money on that kind of, if that health plan is otherwise more affordable in terms of monthly premium or other costs, and your specialist is, partially covered, that actually may be worth the cost if you can afford it. But watch out for the plans, and those are typically HMOs or health maintenance organizations where there are strict rules about seeing providers out of network. If you have a specialist who doesn't participate, or any kind of doctor who doesn't participate, you could be completely out of luck. The other thing I would say, especially with conditions like endo and fibroids, is, as I said before, I understand from just talking to lots of women with these conditions that looking at the clinical guidelines, there can be a lot of trial and error. So start here, move on to the next, move on to the next. And to do that, you may need to, that might not only apply to a medication or a surgery, that might apply to the provider. So there are lots of really talented women's health providers who do not specialize in, for example, endometriosis.
Mhm.
So they might generally understand and know how to treat endo, but if you have a really tough case, that might not be the best provider for you. And so
Mhm.
I would think about where you are in the evolution of your condition. Are you newly diagnosed? Have you had it for decades? If you've had it for a long time, you probably know the drill. You know who you need to see and what works for you, and you want to stick with that sort of set of solutions. If you're
Yeah,
newly diagnosed, you may not know yet what's going to
right.
work for you, and I think you want to really be mindful of maximizing your flexibility so that you can switch doctors or switch facilities if you're not getting the care you need.
Yeah, that's really helpful. So basically, I think what we're telling people is if you already are diagnosed, you have medications you're using, look for your healthcare provider as well as what you're using for treatment on the formulary as well as the in-network providers. And if you aren't, maybe look at all the different providers that are on that list to see, can you find an expert in your conditions to make sure that you can find someone who is going to cover what you might need, or if you need minimally invasive surgery or you think you may need in the future, make sure there are clinicians that you want to go to on that network so that you're not kind of looking out of network and having to pay those costs that might not be affordable.
And could I just add, I once
Please.
interviewed a woman for a story. She lived in Massachusetts, which is not a big state, but we have a lot of healthcare providers. Boston is sort of a mecca for hospitals and
Right.
healthcare specialists. And there was literally one doctor who specialized in laparoscopic endometriosis surgery of the sort she needed. I'm not saying there was only one in the whole state, but for her at her stage in her whatever condition, there was one person she could see. And so, she had to go through a lot to see that provider. And
Mhm.
I think the key is really, it's not just women's health, it's not just endometriosis, it's sort of the very specific specialization that you might need, that you want to make sure you can access. There are appeal processes, so especially if you need a really specialized service, uh, insurers have to allow you to sort of request exceptions and hear an appeal if they say no initially. It doesn't mean you'll win, but there are ways of escalating and sort of fighting for to get what you need. I'll put a plug in for independent health advocates. So I represent a group, the Alliance of Professional Health Advocates, where you can actually hire people. Again, this is not the most budget friendly solution necessarily. It's better if your health insurance just says yes. But
Right.
if you need help and you are not getting the help you need and you're in pain, there are people whose job it is to help you kind of navigate and fight through that bureaucracy. They don't always win, but they
Yeah.
know the game at least.
And that's good to know because we know how complicated it can get. And when you're dealing with a health issue, the last thing you want to be dealing with is the health insurance and the coverage there. You want to be able to focus on what you need to for your body or your family or whatever, and not worry about all the other stuff or worry about coverage. So that's good to know that there are people out there who can help. Are there any other areas that we should think about for insurance coverage for women's health in terms of any essential health benefits or requirements that would be important to women? Sarah, do you want to respond to that?
Sure. I mean, part of the thing with all of these government plans is that they are supposed to cover a certain level of preventive care.
Mhm.
So once you get one of these plans, whether it's through an employer, whether it's through the marketplace, think about reading that list of what you're entitled to. So, your annual checkup with a primary care physician, separate from your annual checkup with a gynecologist. Both of those appointments, you can get STD testing that's included. At a certain age, you can get mammograms. There's basically a list, and it's at healthcare.gov, and you can read it and you can see what applies to you. Even things like breastfeeding lessons, things like that. Just look at what's on there and see if you might need any of those things, and make sure that you're getting it because you're paying for it.
That's good to know. Yeah. And I think people don't even realize that they could get that. And so they might hold off from getting
Mhm.
tested for a sexually transmitted infection or, getting help with breastfeeding or
Mhm.
contraception or their PAP and HPV test or the mammogram, anything like that, and don't realize that they could actually get that, and that's part of their coverage, or vaccines, for example.
Yep. Mm-hmm.
Okay, great. So I just want to touch on selecting plans, because I think that's where we all get stuck, and we're getting these positions where, like, our partner or our employer, our partner's employer or our employer might select the payer and available plans, and they hand it to you, and then you have to go through and compare and look at the costs, the deductibles, the premiums, the coinsurance, all those things that are so overwhelming. So how can we evaluate that and figure out the cost versus the benefits and coverage when we're choosing a plan? What would you say to do to look at first, so you can figure this out and not make it too difficult for yourself?
Well, I mean, I'm totally biased because we have a free self-service tool at predictable.com where you can kind of go in and say, I'm comparing spouses plans, or I'm just looking at my own employer's plans, and we'll walk you through pulling in, what's coming out of my paycheck for each option, what's coming out for my spouse's options, what are my deductibles, if you need to go to the hospital, is it co-insurance, is it a copay? And we kind of walk you through those things slowly. And there's other things you might not even think of, like, does this company pay me if I go off the plan? Or you could have one spouse's plan that looks amazing, and you're going to have a baby, and that would be awesome if you have the baby. But then the other spouse's plan covers fertility coverage. So if you need IVF, you want to be on the other plan. So, we're going to kind of walk you through these details. But you can do all the math yourself too. You can just basically make Excel spreadsheets. And then just at a high level point on timing, one of the most annoying things for couples is when, one person's open enrollment period is for 2 weeks, and then that Friday, the next person's open enrollment starts. But keep in mind that when your spouse has open enrollment, you can go back to your company and say, hey, I have a gain in coverage through my spouse. That triggers a life event. I can now drop this or change. So, just know that is your right. So even if you already did open enrollment in November, your spouse's open enrollment comes up in March, you can still do something.
That's really interesting. I didn't realize that. So I think that most people don't think about it that way. So that's good to know.
Yep.
That's
Can I add just, I think, at a very high level, the thing that I always want people to think about is, obviously when you're selecting health insurance, you're looking at cost. The costs are hidden in lots of different places. So it's really important, Sarah's tool gets at like really deep, the sort of crevices of, how are these things, what it's really going to cost. But if you just look at the premium, the monthly premium, that does not tell you the whole story. You have to look at all the different aspects of cost, and that might be, co-payments are pretty well understood. Co-insurance is a portion of a bill you might have to pay, but you don't know what the bill is going to be. So if you have to pay 20% of who knows, or 10% of who knows, you'd rather pay 10%, because whatever it is, it'll be smaller. Look at the out-of-pocket maximum. That's the total cost you could have to pay for in-network, covered services in a year. And if your out-of-pocket maximum, the cap on your out-of-pocket costs is $10,000, you could have to pay $10,000. If it's $5,000, you're done at $5,000. So these are the kind of hidden ways to think about the cost of care on any given different plan. And then the other thing we talked about before with providers is so important. If your provider is in network on a given plan, even if it looks more expensive, you might wind up saving money and heartache, because you'll either have to pay full freight or most of the freight on seeing that provider out of network, or you'll have to switch. And switching can be disruptive, it can be difficult, it can be painful. If you're not tied to any particular providers today, that's fine. But if you really love a doc or a nurse or a facility, make sure you know what it will cost to see them on any given plan.
Right. So basically, there's no really easy, simple way to do it by yourself. So if you can access some of the free services, it could be really helpful, because there are so many costs and so many details to look into. And I think it can be really overwhelming. So those are really great points of advice to think about, making sure to look at all these numbers and then seeing what kind of services you can find to use, like Predictable or any other services that might be able to help you kind of calculate what that would look like for you if you can do that. Okay, finally, one last question, because I want to wrap this up, but is it too late to sign up for health insurance through the marketplace? Do we still have time?
I mean, it is too late. Technically, it was the 15th, but if you go on some websites, they're saying, hey, if you already started your application, just call someone before Monday. And even if you can't sign up for January 1st, you can maybe sign up for February 1st. So that's really a question of just getting that coverage in place. And then, of course, if you're on an employer plan, that can happen all year round.
Great.
There's still time for February 1st on the marketplace. So what you might have missed by now is for coverage for January 1st, but there's definitely still time in open enrollment on healthcare.gov.
Okay, perfect. Yeah. Well, I really appreciate this, Deb. Sarah, thank you so much for helping us better understand this really important and confusing topic. Mm-hmm. And thank you to our audience for listening in. And remember, if you have not signed up yet for health insurance, there is still time. You can visit healthcare.gov to enroll for 2023 Marketplace Health Insurance before January 15th. And for more information on health insurance and other topics of importance to women's health, please visit our website, www.healthywomen.org. Thank you again and have a wonderful day.